Welcome to another episode of HealthSpeak with MDForLives. I am your host, Dr. Christina Fontana. I am a pharmacist, 5-time author, and business owner here in Pennsylvania. And today I'm so excited to introduce Dr. Lori Roche. We have a very special guest, and she's currently the medical director for both the hospice and palliative medicine team in Pennsylvania. So we're both here from Pennsylvania. She recently retired from Tri-Valley Primary Care, where she served as a physician and owner for over 30 years. Wow, that's really impressive. So I am just so excited to welcome you today. Thank you so much for being here. Today, we're talking about ethical issues in healthcare. So pressing ethical issues faced by healthcare professionals today is the hot topic. So your responses here are going to contribute immensely to our community to a deeper understanding of some of these challenges and how they're impacting patient care. So my first question to you, Dr. Lori, is how do you balance respecting patient autonomy with providing guidance on end-of-life care decisions?
For me, because I've been a hospice medical director for several years, and this is right up my alley, I think a key for end-of-life care is to always respect the patient's autonomy. People come from different cultures and different backgrounds, and they have different ideas about how they want to die. For instance, if somebody was an opioid addict during their lifetime, they may not wish to have any morphine at end of life, which is one of our comfort drugs. But we have to respect that, and we have to give them all the available options with the risks and benefits of those options, and just be compassionate and be there for them. And we will do a workaround to make sure that we help that patient die with dignity and in comfort.
So in your experience, how do you handle situations, which you kind of already talked about this a little bit, but when a patient's wishes conflict with your clinical judgment, how do you handle that?
Yeah, kind of idea. So basically you would explain all of the options to the patient. You want transparency and open communication, and then you would explain to the patient the different potential outcomes based on what they think they want and what we think we want, and what we think might be better for them. But, patients are human beings. They have ideas about what they want to do with their bodies and how they want their healthcare to go. You should never coerce a patient to do what you think is best for them, but work with them to come to some kind of treatment that you're both agreeable with. And then just make sure that, the patient knows that you would never abandon them. I mean, I think a lot of patients are afraid that if they disagree with the doctor is going to be angry, but you're never going to abandon your patient. You're going to be there for them no matter what.
Beautiful, partnership energy there. And I really appreciate that you're bringing that to light here. So the next question is, what are the key ethical considerations that you think about when discussing the use of AI, artificial intelligence, and machine learning or other new technologies in patient diagnosis and treatment?
It's tricky. I mean, ultimately, it's the provider, the doctor, the nurse practitioner who's going to make the diagnosis and pick the treatment. It's not a machine. So AI is a complementary tool to the physician's own skills. So the physician has to make sure that they know what they're doing, and yes, take advantage of AI and let it help you. The patient should be aware that you're using AI. Again, I think you need to be open about what you're doing. You may even want to get informed consent for the use of AI with patients. And of course, any provider should rigorously vet the AI system they're using. It should be a trusted system. But it can be a complementary tool for us.
I love that. So how do you address concerns related to patient confidentiality and data security in the age of AI, digital health records, having all of these different components at play?
We do the very best we can to protect the confidentiality of patients' information and their records. We use encryption, we use passwords, we use two-factor verification. I think all of the patients are aware that there's a lot of bad actors out there who want to steal their data. So we just do everything that we can. We remain HIPAA compliant. We, teach our entire staff how important it is to maintain patient confidentiality and protect those records.
Sense. So how do you navigate ethical dilemmas related to the allocation of limited medical resources, such as during a public health crisis?
allocating resources during a public health crisis that can be tricky as well. I think whoever's in charge needs to make sure that the decisions being made and the allocating of the resources benefit the many versus the few. So you want to have fair distribution of resources. There can be no bias. There can be no bias based on race, religion, socioeconomic status. So you have to be willing to look at the big picture and help the most people that you can. You want to follow a protocol if there's one available. That's very helpful. You want to be flexible if you're in charge, because there's a lot of information coming in during a public health crisis and things change. So again, you want to be flexible in that you can change how you're allocating resources, but always looking at the big picture and trying to help the most people that you can.
And last question. So what measures do you take to maintain professional boundaries while building a trusting relationship with patients? This is a really great question.
To maintain professional boundaries. If you are too close to the patient, too familiar with the patient, you cannot be objective. That's why they don't recommend that doctors take care of their own family members when they have serious health illnesses. If you're too familiar with the patient, you want to maintain your professionalism. Always avoid becoming too close to the patient from a social aspect or financial aspect. You don't want to have that personal relationship. You want to use appropriate language. You can provide empathy and compassion to a patient without becoming overly emotionally involved. And that's what you have to do.
This is just completely again, this is just my own curiosity. So when you how do you express compassion then? Would you, I don't know, put your hand on someone's back to reassure them, things like that? But that's not obviously crossing a boundary, but it is kind of a very interesting question.
Appropriate touch is a great way to show compassion with a patient, to put a hand on their hand or put a hand on their knee when they're telling you something tragic that's happened to them. I think touch, I think language, I think even just looks and body language can show compassion for patients.
So I can tell you make and have made such a big impact on your patients. So I'm so grateful that you took the time to be here with us today. Thank you so much, Dr. Roche. And thank you to our listeners for tuning in. We hope you found today's discussion so informative, thought-provoking. And if you have any questions or topics that you'd like us to cover, please feel free to reach out by following us on social media. So YouTube, Facebook, Instagram, all the places. Stay tuned for more insightful discussions on HealthSpeak. And I am, again, Dr. Christina Fontana, and I'll see you on the next episode.